Hello, my name is Mara, and the purpose of my technical report is to educate young adults from ages 18 to 24 of age in our community about caffeine and its impacts on our health. In this presentation, I'll be including what caffeine is, its effects of caffeine in different bodily systems, and lastly, the dangers. By the end, you'll be able to gain insight in how caffeine impacts your health and make educated decisions on ingesting caffeine. So let's start from the beginning. Caffeine was found in 1819 after being isolated as a active property in coffee beans. It was later on labeled as a psychoactive stimulant drug, and some of these other examples of stimulant substances include alcohol, nicotine, marijuana, and of course caffeine. So it is being put into these bunches because it is getting into your bloodstream. And if you refer over to my report, it will go ahead and explain how it is delivered through your bloodstream. But one of the main things that I wanted to touch on, it is quickly absorbed into the bloodstream and it is getting passed through into your brain. So this caffeine molecule is a chemical based stimulant. It has a half-life of 2 to 4 hours, meaning that it will decay over time and transformed into something else, and it will take 2 to 4 hours to go ahead and lose its effects of the caffeine. Caffeine comes in a white crystalline bitter powder, and it can be found synthetically or in natural products. Natural products being berries, leaves, nuts, and seeds. And synthetically, it can be made with chloridic acid and urea. Both kinds of caffeine are indistinguishable chemically, but they can be seen as different products whenever you add them in different ingredients. When you add them into different products as ingredients. So caffeine in general can be found in tea, chocolate, coffee, and decaffeinated beverages. In my report, I will make a very important detail that many products are not labeled as caffeinated products, but still contain caffeine in them. So for example, decaffeinated coffee still has caffeine in them versus a regular cup of coffee. A normal cup of coffee has about 145 milligrams of caffeine versus a decaffeinated cup of coffee has 2 to 15 milligrams. Again, that is because the FDA does not need to report or label a product as a caffeinated beverages if it does not give off the same caffeine effects as a normal caffeinated product would display. And there is a scale of the caffeine milligram amounts in different products for coffee products and caffeinated beverages. Next, I'm going to talk about how caffeine affects our bodily systems, and all of it is kind of a cascading effect. It starts off with neuro because it can go into your bloodstream, and because it can easily bypass the blood-brain barrier, there is a lot of cascading effects that happen once that adenosine receptor is blocked off by the caffeine molecule. Some of that cascading effects will go into the different bodily systems that are also affected, such as respiratory. It increases your respiratory rate, and such as cardiovascular. The cardiovascular system especially will be affected by the caffeine molecule in the sense that it can decrease the risk of developing certain health conditions like hypertension, heart failure, atrial fibrillation. However, if you are drinking caffeine in moderation or in high consumption amounts, you are running the risk of developing a heart disease called CAD, coronary artery disease, and disease will ultimately lead you to a blockage of the arteries and will lead to a heart attack. So some of the dangers that I want to go over is overconsumption of caffeine. Overconsumption can be up to 400 milligrams of caffeine, and going over that amount can give you awful side effects such as heart palpitations, insomnia, sleep disruption, upset stomachs, nausea, headache, and anxiety. And remember how I said about adenosine, that neuroreceptor is blocked off, blocking off that the sleepiness. That receptor has also been associated with panic disorder and increased regulation or an irregulation of anxiety. So another danger is withdrawals. Withdrawals is something very prominent that may happen if you decrease the consumption of caffeine too quick, and it can give you withdrawal symptoms. And fortunately, it does get better over a couple of days, but it is a never-ending cycle of getting these side effects when you are drinking caffeine, if you go over and if you undertake caffeine. In conclusion, there are many products that have caffeine, and there are many products that aren't labeled as having caffeine. So please make sure you read your labels and you research the products before you are consuming it, because it may contain low dosages of caffeine. Especially right now during finals week, you are pulling all-nighters, you are studying, you are under a lot of pressure, so those heightened senses to begin with are very negative when you're consuming high dosages of caffeine, and it can affect you in those 3 different bodily systems. So lastly, that I want to touch on, if you have any concerns or questions about having caffeine sensitivity, I suggest you go talk to your medical provider if caffeine is something that you truly want to be able to enjoy, and speak to your medical provider if you are pregnant or breastfeeding, because there are special suggestions that go around that in different stages of pregnancy, or if you are breastfeeding. Again, this is all because caffeine can bypass through your tissues easily, so it can get into your fetus, it can get into your baby. So make sure you speak to your medical provider if you have any questions, comments, or concerns about consuming caffeine, and if it is a safe option for you.